So Mike here with your Mobile Health Minute. So this is going to be a quick take. So a couple weeks ago, the CDC dropped some new updated recommendations regarding the COVID vaccine. ACEP, which is basically a committee that sits around and discusses immunizations, now recommend an additional dose of the COVID vaccine to those who qualify. So check it. If you're over the age of 65 and have received a COVID vaccine at least 4 months ago, it's now recommended that you get an additional or updated dose of that COVID vaccine. Additionally, if you're considered moderately or severely immunocompromised, meaning you are taking medication or undergoing treatment such as long-term steroid use, chemotherapy, or undergoing treatment for things like lupus, MS, rheumatoid arthritis, inflammatory bowel disease, just to name a few, it is still recommended that you get a second dose of a COVID vaccine at least 2 months after that first dose. So why these updates? So basically they looked at the data over the course of the winter and saw that hospitalizations were highest among those that were 65 and older. Also, they looked at the data and shows that immunosenescence basically means that the immune system over time as we age weakens, suggests that an additional dose would be beneficial. As always, if you have any questions or concerns, you can call us on the Mobile Health Unit at the number listed below. You can find our schedule at the website listed above. As always, you can reach out to your primary care, and I hope to see you out there.